that is coming from the front lines to share with us her insights and expertise as someone that has been in the industry. And I have Comrade Naman Philemon Cash live in the studio with me right now. Comrade.
Good afternoon. Thank you for having me.
Now, let me start with, the obvious, or should I say, let me start from, as someone that has been in the healthcare industry, why is it that up to this moment, we still have a huge number of Nigerians preferring outbound medical tourism than, utilizing the services of Nigerian healthcare providers?
Okay, thank you. The current statistics, I think 2023, it stated that medical tourism has moved from 1.5 million to about 2 million. That means that it is on the increase, and it's still increasing. People go out there, Nigerians who are privileged. I know it's not every Nigerian that can afford that, but for Nigerians who are privileged, even if it is malaria check, things that should be handled in primary healthcare, you see people traveling out on medical tourism because they have the resources, they have the opportunities to go out there.
So, what can you give us a sense of, the genesis of this phenomenon? How did we come to this point where outbound medical tourism is on the increase, rather supposedly to be on the decrease? Because, like we said, our population keeps growing. If I get it right, we are projected to grow at about 3.7% going forward. And so we expect that the healthcare industry should have been able to also have this projection in sight and be able to prepare themselves to accommodate this growth. What is the genesis of this phenomenon?
Okay, I might not really know the specific date this starts, but I know that history has it that the UCH in Ibadan was the one facility, healthcare facility, that people travel from other countries to come and access healthcare in Nigeria. But today, reverse is the case due to so many factors. From, I think the basic one we can go back to is we are talking about corruption. It started at the point of corruption. When there's corruption in the government, in healthcare, resources are allocated to healthcare were never utilized for such purposes, and then the amount, or the when it comes to budget, how much is the budget allocated to healthcare? So when you look at it, before we start analyzing, I know in the course of our discussion, we're going to talk about the healthcare infrastructure, the budgeting of the healthcare.
Yes.
You see, it's very essential. So you see that our healthcare facilities have become a shadow of itself.
Now, do you think that the outbound over time, because like you are trying to point out, we're going to come to that point where we'll talk about possible whether the budgetary provisions in the annual budget of the federal government or even at the state level, because we also know that medical services are supposed to be assessed in the rural areas as well. And so we'll come to that point. But first, do you think this outbound medical tourism, because if, like you talked about the privileged Nigerians, if the privileged Nigerians are not patronizing or are not using the services of our healthcare, service providers, then it could limit the interest of investors or the private sector from actually financing healthcare service infrastructure in Nigeria. So, do you think outbound tourism, medical tourism, have impact in the development of medical infrastructure in Nigeria as we have it today?
It has a lot. It has a lot. If our leaders, people who are supposed to make policies that will improve healthcare in Nigeria, are accessing healthcare outside Nigeria, do you think such a person will have interest in what is going on? It's just like we say, our leaders should send their children to public schools so that they will understand what is happening. It's the same thing with healthcare. if as a governor, if as the president of a country, if as a commissioner, if as a minister, and then you're accessing healthcare in Nigeria, by the time you go in there, you will know where the problem is. By the time you go in there and you see that even common glove for a healthcare personnel or for a healthcare worker to take care of you is not there, you know that there's a problem in the system. But these people are, let me use the popular statement, they say they are not aware of what is happening. And that's the truth. If you look at the healthcare in Nigeria, people leave Nigeria to go out there. It is even Nigerians that are out there taking care of them. They're not aware of what is happening. You go to the clinics, simple machines that do little investigations, you can't access them. You don't have them because our leaders are out there going out there to access healthcare. So they even go out there, see new things, they don't want to bring it here because they don't know what is happening.
Now, you made mention of the fact that some, or rather, Nigerians that go, abroad for medical tourism are also, inadvertently being taken care of by Nigerian, healthcare professionals in those countries. Now, let's turn the table a bit to this because you are a healthcare professional. So, what is the driving force? What is the fact? What are the factors that are, pushing Nigerian healthcare professionals to Japa, using the normal the slangs? Yes. What is pushing them to prefer to
go out there?
Yes, to go out there to offer their services.
When we're talking about the Japa syndrome, which is so popular, so that in the last 3 years, over 54,000 nurses have left the shores of Nigeria to go seek greener pastures. So like you said, what is pushing them? We have the pushing factors and we have the pulling factors in this. What are the things pushing? What are the things that can push a healthcare provider or a nurse to leave Nigeria to now move to another place or another country to render that same services? There are so many factors. You look at Nigeria, how much is the income
of a healthcare provider?
Yes, and then compare it to those countries that they are being paid. You do virtually the same thing, and then you are paid times whatever, times 10 or times 4 of what you are earning here. Who would say? That's the factor that will push you. And the factor that will pull you over there, we look at that. Look at the insecurity. People are being kidnapped. Last year, as of 2023, 2022, many nurses were kidnapped in Abuja here, in Kaduna, and in other states. And how were the ransoms paid? It was either their relations or even the associations that assisted. So how would somebody be? You are going to work and you're careful to wear your uniform. At the point they told health workers, don't wear your uniform, don't put any sign that you are a health worker because you are at risk of being kidnapped. That's one part. Another part is the infrastructure. We go back to it. There's nothing as
motivating
that will motivate them. When you go to work and you're supposed to dress a wound, for example, and then you don't have the solutions for the dressing, you don't have the consumables for the dressings, and you will be demoralized. Now you have a patient who is looking at you. Can you render this service? But you don't have the wherewithal. The resources are not there. The consumables are not there. The infrastructure is not there to take care of these people. At the end, you come back home a frustrated health worker and you are seeing a frustrated patient. So there are pulling factors, there are pushing factors that are making healthcare workers to leave the shores of this country.
But before we go for a quick break, I would like to ask you this, because you talked about the push and the pull factors.
Yeah.
Do you mean to say that there is no way that the government has been able to intervene in terms of identifying these pull and push factors and making it a bit accommodating, a bit safe, a bit motivating for the healthcare workers to be able to offer the services here in Nigeria?
I'm so sure the government is aware of these push and pull factors, but when there is no plans for such. Rather, what came out from government last year was that they were going to set a ban for health workers not to leave the country. Do you think that would work? I don't think so, because even if a health worker doesn't leave this country, and if I'm not earning well, if I'm not being taken care of, if I don't have what to work with as a health worker, definitely I can change my profession even if I'm still in this country. If I know that, for example, if I know selling palm oil is better than going to do that work, I will switch to that. So it's not just the pulling and pushing factors.
You're going to hold there. We're going to go for a quick break now. And to you, our viewers, just stay with us. We're going to be right back. After this short break, we'll continue with the conversation. On market movers, I still have with me in the studio Comrade Naman Philemon Cash, who is a health professional, having a conversation on specific reasons why the health sector has not been able to meet with the demands and the needs of Nigerian healthcare needs. And joining us virtually is Steve Nwachukwu, who is our in-house business analyst. Steve, are you there? Okay, can you hear me? Steve, can you hear me? All right, thank you very much. Now, Steve, I wanted to quickly intervene at this point. I believe you have been following our conversation, and yes, Nigeria is said to require about 363,000 doctors to be able to meet our healthcare needs. And currently, we have about 24,000 licensed doctors, and out of that number, about 5,000 is said to have migrated to other countries. What do you ascribe to this ugly trend, and what impact is this going to have on the healthcare needs of Nigerians?
Okay, thank you once again for having me. Let me start from the last line of your question. What impact will it have in the nation's economy? First, let me say the fact, which is the obvious, that health is wealth. Health is wealth is an age-old statement that politicians, leadership, and even the religious leaders believe that as much as the healthy the citizens are, it will lead to a better economy, to a better workforce, and the rest is to the positives of the nation. So having stated that, it's important to also realize that in the background of that health is wealth is to make sure that both human and capital and infrastructural facilities that is required to take care of that population needs to be put in place. Now, in the area of human capital, the personnel, like we talked about, the doctors, they are exiting the shores of Nigerians as a result of the pull and the push factors that your in-house guest analysts have extensively told or discussed, that has to do with those factors that perhaps will attract them overseas, and those factors here also that will have to push them out of the working environment in the nation. So these limitations are what perhaps. Are you coming in?
No, go ahead. Finish up your thought.
Okay, so these limitations and challenges are what every political leadership will want to tackle. Just like the ratio you talked about now, about 370,000 needed to care for the population over 213 or 250 million or 230 million Nigerians. By the United Nations standard, we are not even meeting it. We are far off from that. So that is where the government has to realize the need to improve in this area. I really don't see the Japa syndrome from the negative perspective as an economist.
Okay.
I see the Japa syndrome from the positive perspective. It simply implies as an economist to me that the world needs the service of Nigerians. So what it requires of this leadership, both on the subnational level, the state governors who owns and operates most of these health facilities and who also owns and operates most of these teaching hospitals, needs to start expanding and start giving rooms for more students to be admitted into the health sector. We need to have those FDIs. Sorry, we also need to have those diaspora remittances that comes from these our sons, our daughters who are going to Dubai, who are going to Kuwait, who are going to the US, London, name it, to practice their profession. Yes, it is to the detriment of the existing inadequate personnel that we are lacking in this nation. So it should call for an improved expansion of the healthcare sector. Nothing stops the governor, nothing stops the government expanding the existing health facilities. Train more of doctors, train more of nurses, train more of these medical personnel.
Yeah.
The world needs their services. So we should see it from that positive end.
Yeah, so what you are saying in essence is that, you know, our healthcare service providers, our nurses and doctors could become one of our export commodity, if I may use that word.
Of course. India is doing it.
Yeah.
As we speak, India is practically doing it.
But we have a situation now.
If the world needs our service, we should understand it from economy.
Yeah, I think I agree with you. Let me quickly come back to Comrade Naman, who is a healthcare professional. Now, based on the World Health Organization standard, Nigeria is supposed to have one doctor to say 600 patients. But we have a situation where we have one doctor to about 1,000 patients. How can, following from what Steve is talking about, we being able to export, our doctors and nurses to other clients? How can the government, as someone that has been in the system, how do you think the government can actually groom, enough nurses first to meet with the WHO standard for our use before we can think about exporting?
Okay, thank you for this analysis. I think I agree totally with what he said, but like you said, according to the WHO, let me use the nursing, which is my own primary constituency to speak based on the WHO standard. The standard is that at least is a nurse to 4 patients per time. Now we have a huge challenge in Nigeria. That you see the least you would see in any facility that a nurse to over 31 patients per time, and you see most times these patients are in critical situations, critical care. Now, how does this person cope? Now, looking at the business side, exporting our services is a very good one. I think apart from India, South Korea is doing that. They're exporting the skills for their professionals, of their professionals to the advantage of their countries. Nigeria can do that, but obviously we have a problem at hand. The ones we have at hand are not yet enough, to the point that you see healthcare workers are so overwhelmed that it becomes, most times you see patient relatives even beating them. But how would the government now go into this? I think what the government may better do now is if they can subsidize the training. Train more health workers, subsidize the training. In terms of
subsidizing the training, do we first of all have enough training institutions? Do we have enough nursing schools? Do we have enough teaching schools, hospitals, medical schools? Do we have enough of these?
I think recently, like for the Nursing and Midwifery Council, they're actually given a lot of approvals for so many institutions lately. But there are limitations to the admission numbers, so it's never too much if the government can establish more training institutions, one.
Okay.
Number two is that they subsidize the training. But if you look at Nigeria, the major reason why this Japan syndrome persists is not even that we don't have the health workers. We even have some that are not even working. They are not being employed. So what do we do with this? Employment, you've not even employed the people on ground. Now we have countries that are ready to take these people. There are even how do I now put it? People who are retired, like the way Nigeria go to import fairly used cars.
Yes.
Other countries come to Nigeria to even employ
retired
professionals,
health workers.
Because to tell you that our trainings are good, our professionals are skillful, but the country needs to do more when it comes to having more institutions, subsidizing the training. Now, if somebody now goes out there, you can have the record. The recent statistics I saw is that about $54 trillion was what came in from Africa, from all these people out there. Remittances from outside of Africa. So if the government can look at this in the positive perspective, we can change the conversations from saying no to Japa to now say, okay, fine, we're doing business. We're doing this to the advantage of the country. We're doing this to build infrastructure for our healthcare here. But you see people go out there, even there are Nigerians that are out there, there are healthcare workers that are out there, that I'm so sure that if things are okay for them, they would want to come back to work in this country. So if the government sits up, we will do it with the side of business.
Yeah, let me go quickly to Steve. So I see you shaking your head there. What is interesting that she has said, and do you agree with how you have, an alternative solution for the government?
Perfectly. I think she actually expanded my line of thought. The economics of the Japan. Let's not use negative perspective. Yes, we have inadequate supply of this medical personnel to our existing environment. Can you hear me?
Steve, go ahead.
Okay, so if this is a fact before us, just like she actually expanded in that line of thought. What government needed to do, like I call upon the subnational government, the state government, you find these teaching hospitals and the rest of them. What stops them from voting money, huge amount of money to expand these institutions so that the accreditation will expand? Why should the rest of the world needing our medical personnel and we are rather training engineers or training mass communication or training other disciplines that the world doesn't need? So it is a question of where the demand is. What is the demand of the world from us? So if this is what the rest of the globe needs from, look towards it. That's why I said I really submit to her opinion and the expansion of the line of my thought that government should look inwards and start seeing programs they will run, just like it said, subsidizing education in this regards.
Now that is
medical schools.
Yeah.
And make sure that we trunk of these very trained individuals that could play in the global market and return to us the forest we are looking in form of diaspora remittance.
Very interesting
So we should
conversation
not
there.
see the Japa from this negative point of view. See it from this positive and work towards it. That's the essence of leadership. That is the essence of that paradigm. That very pragmatic we needed from our political leadership to see the reasons why they have to do all this and catch up with time.
Now, Steve.
So that's my submission. I totally accept, I totally agree with what she said.
Of course.
That subsidizing these very programs will help.
Now,
Thank you.
I think I can see that from your body language that you totally agree with her. But, speaking of agreement, the government in the 2024 budget allocated about 1.3 trillion naira for the healthcare industry. Do you think that budgetary provision which is less than 5% of the total budget of over about 27 trillion naira. Do you think that budget will help in this scenario now, where we are supposed to focus on expanding education, expanding STEM education, or focusing on medical education, as it were? Do you think this budget can help this kind of analysis going forward?
Not at all, not at all. In fact, that's why most times we query and questions the characters and the kind of people we have as our political leadership. In the process of planning and computing those numbers for those budgets, budgets are the expressions of the political leadership. Budgets are the wishes of a political leader. If actually this political leadership have realized or seen it from this perspective that we have seen it, I don't think they'll be having anything less than 4 trillion in the 2024 budget. In fact, put together the national budget of state governments, all the 36 states and FCT, the capital components of both whatever in those budgets in the health sector is still less than 2.7 or 2.4 trillion. It does not account to what the need we just expressed now. It does not show the concern that there should be an aggressive investment in the health sector. And next this opportunity, it may not come. Other countries may fill those positions, and the world will be looking towards those countries. Now they are focusing on us. They are even writing officially, making official pronouncement, making official move. In fact, recently, is it not Saudi Arabia a conference where they are, doing a sort of what they call it to pick the individual diagnosis and doctors. So why not the federal government see the need and tertiary education institutions so that we can maximize this opportunity? So the 1.3 trillion is not sufficient. It does not take account of the exigency of the needs we have in the health sector as we speak. Thank you.
Yeah. Now, I think I will come back to Comrade Naman in the studio. Before I come back to you, Steve. You mentioned about Saudi Arabia, other countries coming into Nigeria to have some form of expo, on how they can attract our, healthcare professionals to their country. And you have also mentioned India. I think you are the one that actually talked about India, that exports, their professionals in the tech space, in the tech sector. And if you look at what India does, especially with most of those big tech companies, they have they attract companies to set up shops in India, and they have some form of working relationship, collaborative relationship that they seem to establish between those tech companies. So I want to ask you, as someone that has been in, someone that is in the healthcare space, have you seen Nigerian government having collaborative ventures or collaborative activities around, knowing that, for instance, the Saudi Arabia that Steve talked about, knowing that, okay, Saudi Arabia is coming to have an expo to attract doctors, have they been able to have a way of also making them to invest in, because we're talking about training more of these professionals. Have we seen anything that government is doing to make these countries, whether it is UK, Saudi Arabia, or other European countries, to invest in our healthcare space?
Okay, before I talk about what the government is doing or what it needs to do to these people coming in for our healthcare workers, I want to comment on the budget. That you said in 2024, the budget is less than 5%.
Yes.
In 2001, there was this African Union presidents. They had their conference in Abuja. It is popularly known as the Abuja Declaration. In 2001, all these African the African presidents agreed and signed the MOU, the agreement that for each of the African countries, every year's budget for each country, when it comes to health, it shouldn't be less than 15% of the budget each year. But this is over 10 years now. Nothing has happened. Last 2023 was about 4% of the budget. This year is less than 5%. So where are we? The Abuja Declaration said 15% of each country's budget annually should be for health. Why? To train the health workers, to ensure that the healthcare facilities have all the infrastructures that it is needed. Because we understand that healthcare needs to be accessible, needs to be affordable, and it needs to be available. But how many of our communities have all these facilities? And somebody is looking at it, and each year we keep having budget allocation to health that's less than 5% of the budget. Is quite disheartening, and I think our government needs to wake up. So talking about our government now negotiating with those other countries coming to take us, like I said earlier, I said even South Korea is into this export of skills. Nigeria can do that. That's why what comes with this conversation. I know what Steve was saying. She said he's looking at the advantage of this. Are we sure our leaders are looking at the advantage of this? Because if they were looking at the advantage, they wouldn't have come out with the policy of banning health workers from going outside of the country. It's for them to look inward. What is the advantage? Let them do a SWOT analysis. What is the advantage of this high demand of our healthcare providers to us as a country, to the economy of Nigeria? How do we change the conversations from banning these people to look at how the economy of Nigeria will improve? How do we negotiate with these countries that come officially to Nigeria to say, we want your healthcare workers because we believe in them, they have the skills, and we like the services of those who are already there. So how do we start? The Nigerian government can negotiate with these people and say, okay, fine, as you're coming in to pick more, this is what it will cost you from the training stage. As you are picking 10, you must make sure you bring in something that we can train more for you, so that we'll have more here and more to export for you. But you don't just come pick them. We don't even have enough, and you are coming in to pick them with your own pulling factors. Whatever factors you are bringing in is pulling them out, but we are not having any conversation. I think the government needs to change the perspective of all the conversations from banning health workers, seeing the jackpot syndrome in the negative side, and bringing it, okay, it is to our advantage. How do we maximize this advantage that will help Nigeria, that will help going forward?
Yeah. So Steve, she talked about the Abuja Declaration. That is something that, it's not just that the usual way where our leaders, our political leaders go to abroad, go to other countries and sign agreements and just put it in the cabinet. This was signed in Abuja. I expected that we should be the one driving this. What do you think? Who should we hold responsible for not implementing this Abuja Declaration?
Thank you so much. Unfortunately, most of the declarations on bilaterals that you often see most of our political leaders sign is totally hypocritical, in the sense that there's no sincerity of purpose. While a presidents of Africa will gather and look at the issues and past the inadequacies in the health sector in Africa, and they have done their maths, and they think that the minimum investment in healthcare should be nothing less than 15% of their annual budget. And to date, none of these African countries have been able to attempt 10 or 12% implementation of such declarations. So that's why I say this is hypocritical, no sincerity of purpose. In the background of the universal health investment in most of these African countries, in particular in Nigeria, Nigeria needs more than $10 billion annual investment. $10 billion annual investment in the next 10 years to mitigate or to fill up the gap of inadequate health facilities. Health tourism is just like your in-house analyst, Cash talked about, Comrade Cash. A percentage of Nigerians, most of our elites, both in political and economical elites, are drawn out of the shores of Nigeria just as little as malaria because of these inadequate facilities and infrastructure system. So a huge investment is needed. Like I said, available statistics shows we need more than $10 billion investment annually, $10 billion in the next 10 years to fill up the gap of these very infrastructural deficits. So there's no better way to call on government than to tell them to be sincere. At least meet your declaration, Abuja declaration of 15%. That will go a long way in helping us meet the universal health care coverage.
So Steve.
Now we also have some areas that also to improve in our health insurance scheme, or what you now health insurance, whereby it is now mandatory for universal health coverage or health insurance for public and private sector workers. This is a long way. It will also help to improve those facilities. What health insurance scheme or health insurance coverage implies is that it's a pool. You are trying to aggregate funds. By the time that is a daily or monthly deduction or contribution to them is a sort of pooling funds which is running into billions and trillions of naira in a couple of years that will be reinvested in our health sector. So government should increase the percentage that such employees and employers will deduct on monthly basis for health coverage or health insurance. That is another sort to raise funds to finance most of these decades. Let me repeat it again. If 1 million people are to pay some certain amount, let's say 1,000 naira, that's about 1 billion naira. And that 1 billion naira will not be squandered. It will be reinvested. It is purposely for the health sector. Those health facilities that will receive those funds will help them expand their health infrastructure. So it can be driven by a policy of government so that you can pool these funds, so that this money will be invested or reinvested in the health sector. If my workers are covered, it simply means whether they use the service or the other, this money has been deducted and be paid for this insurance scheme. It means that this money has been cordoned off for the health sector, and those who are in custody of it will be able to reinvest it in infrastructural development in this health sector. So government can use policy to drive this very fund needed. Like I said earlier, we need more than $10 billion investment annually for the next years, and you can use policy as such
to drive such funds, to drive that process. That is a huge investment, noting where we are in the country in terms of scarcity of funds. But again, I think the point you made, which is very, very acceptable to me, is the fact that let them begin with the Abuja Declaration. Whatever budget you are comfortable with based on your resources, your available resources, allocate 15%. And there is something you pointed out, which is the health insurance scheme. I want to come back to you, Cash.
Okay.
What is your assessment? There is this, the HMOs, what do they call them, health management organizations, like Steve is trying to point out. What has been our experience? Because if based on the recommendation of Steve, that we can use this health insurance scheme to be able to pool, resources to reinvest in our healthcare industry, healthcare infrastructures. Can we just have an assessment of what they are currently doing in terms of providing healthcare insurance services to the workforce?
Okay, I think the healthcare insurance scheme, which is now the NHIS, National Health Insurance Authority, I think one of the best policies of government, because the aim of that insurance was to ensure that Nigerians, all Nigerians, access healthcare and makes it available. Unfortunately, we have a systemic problem. Why do I say that? You see that first, it is targeted at only civil servants. I think now that it's coming down to others.
I think it has been coming up to the private sector.
To the private sector.
Yes.
But a typical person in the community, how does that person access it? That is another story. Now coming to those who are even contributors to the insurance scheme. Many of the services you go to access, they'll tell you it is not covered by health insurance. That's the number one challenge. Some of the medications, they'll tell you, okay, for this drug, this brand of this medication is not covered by NHIS. So if we are to assess this, it is a very interesting scheme, but certain factors are making it not to work in this country. So that insurance would have been a very good policy. But I think if government can improve on the insurance policy, it will help Nigerians going down to the private sectors, to the informal sectors, that everybody can access health. Like the way Steve said, if Nigerians can contribute a little, everybody contributes, even if it is monthly. And we know that this is for the healthcare in this country. The challenge now is, if we gather this money, it goes back to what I said earlier, the corruption in our systems. How will these funds be distributed? So we must set up policies that are good just like this, but it needs monitoring. Because the healthcare insurance program is a very good one, but Nigerians complain a lot about it. Because you go in there, they say, no, for this kind of service, for this kind of procedure in the hospital, it is not covered by health insurance. So it's a big challenge for Nigerians.
So Steve, are you there? Let me come back to Steve.
Yes,
you are the one that brought up this recommendation. From her assessment, do you think that your recommendation would work? And if it will work, how can we achieve that? Do we need to have like she pointed out about monitoring? Do we don't have a scheme or an agency that should monitor? I mean, tell us, how is it going to work?
Thank you so much. Like I said, mine is to look at the economics of these very issues that we are looking at. I know that the secondary leg or secondary aspect is what you have looked at, the inefficiencies, the linkages, the limited coverage of this very scheme that, yes, you can't afford to do this surgery and all those stuff or higher medical requirements. Basically, it's malaria and other smaller typhoid and the rest. In fact, even in the malaria and typhoid, I learned that there are particular drugs they cannot even prescribe for a patient. But mine, which is a primary aspect of it, aggregates these funds to pull these funds together. If a number of Nigerians visit these HMOs who are accredited to provide this health service scheme, it means that if they have one branch, in the next 2 years they will have 2 branches. Remember, they are not primary source. They are serving as a primary healthcare facility. They may not be tertiary or secondary or tertiary. So it's a question of those investments that we needed. This is a very short form of pooling funds so that the capacity and even the expansion required to meet these medical needs of Nigeria. About 70% of Nigerians treat themselves out of their pockets.
Yeah.
And this scheme is meant to actually cover this very percentage so that we have more Nigerians who will be insured. But like I said, the primary focus of me, which is the economist of it,
yes,
looking at the huge investment that is needed in the health sector, is to pull these funds. By the time good number of Nigerians subscribe to this insurance scheme, now that is now National Health Insurance Authority, no longer National Health, is now like a regulator, beyond a regulator, it now gives them power also to do some other certain things. But most importantly is to pull these funds together. We need to expand the scheme further. We need to make it more affordable, more accessible to Nigerians, so that this pool of funds that runs into billions and trillions will be used to reinvest in our health sector. That is my concern, and that is the economics of it. We may not actually need budgetary provisions, but you are using policy of government to drive these very funds that you needed. If all of us, if these things are affordable and a good percentage of Nigerians who spend out of their pockets, we now go through this process, let's assume 50%, you will have a huge trillions of naira
that can be reinvested
yeah,
in the health sector.
Exactly. I agree with you. Now, thank you very much. As we begin to wrap up the show, let me come back to Comrade. We all experience COVID-19. Sure. Do you think if COVID-19, and I believe none of us want to experience it again, but of course these are issues that, you know, pertains to life and seasons. So do you think currently we have enough infrastructure or investment, we'll be able to make enough investment to prepare Nigeria healthcare industry against such emergency?
I don't think so. You said, do I think we have enough?
Yes.
I don't think so. We're talking about the budget. With COVID-19 to 2020, I thought that after COVID, as we survived COVID, it would have been an eye-opener to Africa, to Nigeria, that we need to do more in the healthcare sector, because COVID was what really exposed us and showed that we have not been ready when it comes to healthcare. It's just that God saved. Like, I know we are religious people in this country, and we always believe that everything is left to God. And actually, I don't know how God really did it. If not, so if COVID were to have been like the other parts of the world, I don't know what would have happened. But despite that, the number of lives that were affected by COVID, very important personalities were part of the patients. But still, after COVID, nothing is being done. That would have affected this.
And the selling rates at 1,120.